precautions and do's and don'ts which we have to follow as we come towards the end or probably even post-lockdown period. Okay, so would like to welcome Dr. Kapil Zirpe, who's the Director, Neurocritical Care of Ruby Hall Clinic and past President of ISPCM, and Dr. Subhal Dixit, Director, Critical Care of Sanjeevan and MJM Hospital, and he's also the immediate past President of ISPCM. So both of them readily agreed to interact with the industry on a very short notice, and I'm very grateful to them for that. So without wasting any time, I would like to request Dr. Zirpe to kindly start his presentation. So he'll be, I guess, giving us an overview about COVID-19, and then it will be followed by presentation by Dr. Subhal Dixit.
Okay.
Over to you, Dr. Kapil.
Yeah, Prashant, thank you for kind introduction. Myself is Dr. Zirpe. I'm from Ruby Hall Clinic, and I'm an intensivist. Plus, I'm at present in charge of the isolation ward in Ruby Hall Clinic. Welcome all participants. The whole purpose of this particular webinar is to give you the idea regarding overview about the corona, what is happening around the world and India, followed by what we may face after the lockdown, and then we'll have the question and answer. So everybody's able to see my slide?
Yes, sir. Yes, it is visible.
Okay, so we all know that what is happening around corona. There is a fear, there is a panic, there is a lot of discussion on WhatsApp. One should know what is corona. So basically this was initiated as a cluster in Wuhan. Then what happened in November, December, the authorities suddenly observed that there is a atypical pneumonia presentation. There are many patients are coming to the private hospital, government hospital, and they start realizing something is wrong. Somewhere something is wrong. Then they, when they search this out, they find that there is a particularly one virus which is not known to the world is probably enter into the human, and this was nothing but the corona. So it is known as a SARS-CoV-2. That is means what that this is a systemic acute respiratory symptoms by the coronavirus. Coronavirus is known since decades. The first coronavirus one happened in 2003, but fortunately that was an endemic limited to the China. Then in 2013 there was a MERS, that is a Middle East respiratory virus, but again that was endemic to the Arab countries. So everybody thought initially it might be the endemic, but unfortunately it happens to be the pandemic. So now it is labeled as the SARS-CoV-2, and 19 word is used because it was first detected in 2019. So this is mainly the respiratory virus. That means it affects on our respiratory system, results into the pneumonia and causing a disturbances for diffusion system and related with the hypoxia. Then this was initially found in patients who are coming from the seafood market, where the live animals are sold and where it probably originate, and it matches with the bats some strain. So this is a animal virus. So we do not have any immunity in human. And unfortunately, this particular virus developed the capacity from person to person transmission. And that's where we lost the control over this viral spread, and almost more than 200 countries across the continents are affected. And look at the international scenario. International scenario is day by day worsening. These are the yesterday's figure. You can see the more than 27 lakhs cases are up till now detected. More than 1.8 lakhs are dead. But there is a good news. There's a good news which nobody is trying to highlight is more than 75 lakhs are recovered. So it is not so very virulent virus, but causing a lot of death because of its contamination. It's a rapid spread, and approximately 5% to 10% require the ICU admissions across the world. And coming back to the Indian statistics, these are again the yesterday evening figure. Up till now, we have the 21,797 cases, 659 deaths. Total recovery is 4,376, and active cases are 16,735. Not bad at this stage of the pandemic. So what is happening? How this actually they get transmitted? It is simple to understand. This particular figure depicts it very nicely. So this is the infected person who is coughing around. So there are two types of the, you can say the droplet. They are the large molecule and they are the smaller molecule. So those who are the large molecules, they drop down to the floor and the bed. They drop down on the hands and they are dropping on the surfaces. And when anybody comes across the contact of these surfaces, they get infected. That's why it is called as a droplet. But unfortunately, WHO declared 15 back it is as an airborne also, because the minor molecules, small molecules which are remaining in air for few minutes to hours, and they can get infected at this thing. So this is a droplet plus airborne. If it is a droplet, it was not seems to be the very serious problem, but because of this airborne nature of the minor or micromolecules, it is causing a threat to the human to human transplant on a rapid scale, and that is what happening across the world. So another figure to depict it is a very natural course is see, this is the infected person, he sneezes, these are the molecules, they can get contaminated to the hand, if we shake hand and it will get contaminated to person, or it cups, it touches to the different objects or the sitting or knobs, you get infected and you can this thing. So basic to understand that you have to have maintained the good hand hygiene and social distancing is might be the answer to prevent this. So the next question is what might be the common symptoms? Common symptoms being a viral infection, the fever is the one, it has to be there, might be headache, might be dry cough without running nose. Some patients comes with the breathing difficulty, some patients come with the myalgia, fatigue, mental, you can say the drowsiness, or some patients may come with the diarrhea. So this is a varied presentation of this particular virus, but common is cardinal symptoms of the corona, the fever, headache, dry cough, and might be the breathing difficulty. So how you can diagnose? The diagnose, you have to do the lab test. You can take the throat swab and send it to the NIV. There are very few labs which are available at present in country. They can do the swab. In future, or might be we'll go ahead with the further rapid testing, which will allow us to do the testing in a large scale. And the treatment, there are very few drugs are available, and that is the cause of the panic all over the world. Yeah, we are trying so many drugs, and because the time is limited, so we are not able to prove this drug might be the right one or this drugs may be this thing. But what is the present line of the management? Present line of the management is early detection. If anybody has the symptoms, please visit to your nearby doctor immediately. Take bed rest, do maintain your hydration, maintain social distancing, take a lot of water. If there is a temperature, take the crocin. And there are certain drugs which are trying at present all over the world is the hydroxychloroquine. This drug is supposed to be effective in this particular virus. We are trying in mild, moderate, severe cases. In certain severe cases, you can try some antiviral drugs like lopinavir or ritonavir. And there is another antiviral, remdesivir is there also for the trial. But again, I am saying because of the limited period, because of the, there is no time to prove it whether it is the only drug or it is the only right drug. We are giving all these drugs because we want to save the maximum lives. So the most important part, who will be at higher risk? Younger populations are less risk, but that doesn't mean that they should move around. What will happen if your younger population acquires this infection? Might be they will not suffer anything, but when they go back to their families or friends, if there are older adults or if there are people with the asthma, with the comorbid conditions, if the people with the immunocompromised status or those who are on the steroids for the various illness, they are at high risk. So might be the young population will escape without any major illness, but these are the high risk patients where we have to be very careful. We have to be very careful to avoid the contact with them. So please remember the older adults more than 65, people with asthma COPD who are on regular treatment, those who are having the HIV or those who are having on the steroids or they are immunocompromised because of some reason, they will be on higher risk. So please avoid contact with these people, even if you do not have the symptoms. Might be you are a symptomatic carrier. So simple way to summarize how to protect yourself. That is what we are everywhere now. We are doing the lot of communication. First thing, wash your hands with the soap or sanitizer for at least 20 seconds. Please, washing hand for 20 seconds with a different step is more important rather than just putting your hand under the tap water. Doesn't mean that the wash hand. You have to thoroughly wash hands. When you are coughing, cuff it on the handkerchief and then dispose of that handkerchief properly in a dustbin, or you can wash it. Don't cough on your hands. That is a way of transmitting the disease. Avoid close contact. Social contact, social distancing means avoid the close contact. That means the physical distancing. Even if you are at home, please avoid the close contact within the 1 meter. Don't unnecessarily hug anyone, don't unnecessarily touch anyone, don't unnecessarily kiss anyone. These are the very basic steps in the physical distancing. Social distancing doesn't mean that you stay at home, and by staying at home in a cluster like 8 people are sitting in a hall and playing carom or chit-chatting and touching unnecessary to each other. That is not done. So please remember, social distancing means physical distancing, and you have to maintain at home. So then clean and disinfect your objects people frequently touch. What do you mean by that? Like those are the objects which are frequently coming across your day-to-day practice, like the door knobs. Everybody touches that before the opening. So what we'll suggest in the offices, you can keep the either door open or keep the push facility. So if somebody wants to open the door, he'll open it with the push without touching the knobs. Second thing, use your non-dominant hand, because that non-dominant hand we never touches your mouth, and this all usually with your non-dominant hand. Clean those surfaces like telephones or your computer keypads, knobs, everything. Just appoint one person in your office to just do it every half an hourly or 1 hourly, meticulously washing the all commonly touched surfaces, so that this will not allow the virus to stay on that particular subject. And then stay home when you are ill. That is means, if suppose it is see, this all types of the pandemic can be prevented by the self-discipline. What is mean by self-discipline? The person himself should know what he's doing. If he's having the common cold, fever, please stay at home. No need doctor should tell you that you don't come on the work. You have to stay at home. If somebody you observe your colleagues is having the common cold, fever, just request him to stay at home. So sick or ill people should be stay at home. If your employee is having the asthma, COPD, or he's on any steroids, please request him to stay at home for next 1 to 2 months. It doesn't matter what on post he's working. He can work from home. This is how you can utilize this social distancing and the safe and stay at home, allowing other people to remain uninfected. And if you are having the further worsening of the symptoms, show it to your nearby clinic or doctor. Take immediately treatment and get that disease managed in short time rather than worsen into the moderate to severe cases. So everybody talk about the social distancing. Please look at this figure. It is one of the nice way to display and depict what you mean by social distancing. If you observe, this is suppose this is an infected person. If you come contact with the in day 1 he is infected, on day 5 he infect the 2.5%. But if you do not follow the social distancing, at the end of the 30 days there will be 406 people, and this is a chain of the event. One person, then day 50 will be 2.5, on day 30 will be 400. So that person, 406 people will have again the 406 people, and like that thousands and lakhs and millions people can get infected. Suppose if everybody follows 75% of the social distancing, look at the dramatic drop in the number. One infected person will infect 0.6 people, even not the 1 people. And this at the end of the 3 days, 30 days, they will infect the 2.5. So if you follow the 75% of the social distancing, at the end of the 4 weeks, we landed with the only 2.5 people. So this will help to flatten the curve. What is meant by flatten the curve? Suppose if we do not follow social distancing, in 1 week, you will get the 10,000 people. And if you follow the social distancing effectively, might be in 1 week you will get the 100 to 500 people. So what is the major difference? If the 10,000 people comes within 1 week, the whole healthcare system will collapse, and then we cannot save the even salvageable patient. On the other hand, if the only 100 to 500 people come in 1 week, you will give attention to each and every patient, and we might landed with the saving the 95% of the patient. And this is what happened exactly in Italy and Spain. They are able to avoid the social gathering that results in the 50,000, 80,000 patients within 1 week, 2 weeks, and the whole health system collapse, and they are landed with the 1 lakh and 2 lakh deaths. Even if you follow the 50%, you will land with the only 15%. And that is what the one should understand, what is the importance of the social distancing. So friends, to summarize, if you want to protect yourself, do the hand wash, 20 seconds, put a mask. Mask now it's universal. Everybody should wear a mask when they are dealing with another person. If you are coughing, please cough it on your shoulder. So it is not a frequently touch, so you can avoid the contact. And social distancing, maintain the 1 meter distance amongst you. Please tell your in your offices or the employee site, stay away, avoid the lunch together, avoid the dinners together, avoid the parties, avoid the tea and coffee, avoid the unnecessary chit chat. Once you enter in your department, do your work and just leave that place once your job is over. No need to stay back and had some cup of tea or chit chat. This is what is making, and this you should do it for next 3 to 6 months. Please, my friends, remember, this is not for 1 week or during the lockdown period. We have to maintain the self-discipline for next 3 to 6 months. Then only we'll able to tie over this crisis. Otherwise, we are not far away from the disaster. And this is my team who is working in isolation. If you don't want us to be in action, I request all of you to be follow the all guidelines. Thank you.
Thanks, Dr. Kapil. Dr. Subhal, would you like to do your presentation?
Yeah, I will start my presentation.
Yeah.
I will just go to.
So we will take some questions at the end of the session as you finish your presentation.
Where to? Yeah, I'll just start sharing the screen now.
Okay.
Yeah. Can everybody see?
Yeah, we can.
Yeah. So thank you, Prashant and Maratha Chamber, for inviting us to speak on these topics today. And I've been asked to speak upon the precautions, do's and don'ts towards the end and post-lockdown. Kapil has also ended at the right time social distancing and the importance of social distancing, how it should be taken care of, and that is very important. And most important, during this time, we all must have had Arogya Setu app, and this helps you to track the infected patients which are nearby. And along with that, it is important that the social distancing is maintained. And as you start opening up, and as you prepare to start opening up, you have to share your knowledge. And you also need to plan and utilize the times and spend quality time to prepare the financial plans for the rest of the year, because it's going to be a real economic slowdown, which is really going to hit each and every sector. I'm not an economist or into a pharmacy to tell you exactly which is the best way. You people are the best people. So the most important you should have is a positive life and positive outlook towards everything. And most importantly, the life after lockdown, how it's going to be. Most important is you have to practice a good personal hygiene. You have to wash your hands regularly and do not touch the danger area of the face. And you have to maintain the social distancing as far as possible. Now, the life after lockdown, you have to remember that the 6 feet of distance always have to be maintained. And a vaccine or even a herd immunity is going to come only after 12 months to 24 months. But before that, social distancing is the key. You have to avoid as much as possible to go to social events, movies, small parties, or even malls, and avoid crowded stores. And these things should continue for a period, almost for a period of 6 months to 9 months, or certain recommendations which have also come after discussing with the Chinese authorities. They have also mentioned it for 1 full year. Because over a period of time, this is like a virus disease. So corona is possible that it may stay with us like dengue or even like H1N1. You must also have a no-touch policy. You must also start using digital payments, and also avoid shaking hands or giving hugs, which Kapil has already said. You should wash and disinfect and infect all the homes every third day, and disinfect the office also daily. And in fact, even the curtains or even all those sofas and all which are there, they also should be disinfected as far as possible every third to fourth day, which is there. All the temperatures of all the people, the employees, even the self, the families, all the isolates, and all the family members who are attending into the office, entering in the office, they should be regularly checked, and they should continue to maintain us, give a self-declaration form that they are not suffering from cough, fever, cold, difficulty in breathing. And you must have a thermal scanner or a thermal gun to note down the temperature, and a temperature below 98 is important, and then only they should be allowed. You should stop smoking. You have to wear mask continuously, and you have to inform the authorities that if you have any of these symptoms which are there. And most importantly, you have to keep yourself updated with the current nearby government authorized centers where you can approach for any help or medical help, and get in touch with your local family physician to get in touch with it. We have already seen these protocols. If you are entering there, if you have visited some place where you are normally not visit, if you find it's a very dirty place, you should try to leave your shoes outside. Do not touch anything if you don't know that place. Use a tissue paper and as far as possible to turn the doorknobs on, or you should use a non-dominant hand. You should come, and you should already travel with only the minimum amount of things with you. That will leave your purses, keys, and wallet at the nearest entry point. Wash your hands every 20 seconds, and wash all the exposed areas, and including the mobile phones also need to be washed, and they also need to be cleaned with the help of alcohol solution of more than 50% for alcohol. So the suggested plan, which is also there, is into the different industries. This I've also taken from the government guidelines as far as the manufacturing, construction, aviation, healthcare industries, hospitality, which will all gradually start opening up from the 3rd of May, if at all, if the government decides to open, and if we don't have increase in the number of cases. So most important is adequate learning. There has to be a positive attitude, and this positive attitude, the fear must also go, and a safe protocol, and this all coming together is going to help us into the growth. And that is what you start preparing for the post-lockdown. Most important, the post-lockdown, the senior management people should start meeting almost 1 week to 10 weeks prior to the date on which you are going to start opening up. And you should prepare these guidelines. You should inform these guidelines, prepare these SOPs, jot down these SOPs, and these all SOPs should be informed to all the people who are working in the office, and they should be displayed and informed by mails and SMSs to everybody. The participation of each team member is important. As I said, communication has to be very strong. Every company should form a COVID task force management team, which is formed by competent persons to prepare the SOPs. They have to be a very good listeners, and you should be available 24/7 for each and every members over calls as well as emails. The most important communication, as I told you, must be made at least a week prior to the date you are going to open up the office, and the HR team, the security, and the senior management also comes into play here. And in the senior management also should discuss and reduce the visitors and avoid meetings, and you should encourage more and more digital amount of tools and digital kind of meetings. The most important thing in the case of managing the industry, this I got a very good thing as far as the guidelines which have come up from Maruti Suzuki, is safe for self, safe for family, safe for the colleague, safe for the transit, and safe for the workplace. And all the safe for the self is you should wear a mask, and the mask should be provided to each and every all employees. Sometimes hazmat suits, PPE for all the staff dealing with multiple people, and awareness should be done through training and well as also through the doctors. In case if mask is somewhere forgotten, the company should also make arrangements for providing of the mask to his employees. Because the safety of the employees also means the safety of the family, because this itself is also a part and person. He is a member of the family of the company, and therefore every employee of the company has to be updated with the COVID-19 guidelines and what are the mandatory non-contact body temperature scanning, as I mentioned. The colleague safety is also important. You should start off with continue to work power with about 50% of the manpower rather than starting off with 100%. Maintain social distancing. You have to keep marketing and also the crowd gathering also to a minimum level to avoid social gathering. The employees also which are there should be divided into shift, and alternated day rosters should be kept and prepared, and they should have staggered shift and start time and end time. And there has to be a gap of at least 1 hour between or the ending of one shift and the starting up of the another shift, so that you get a 1 hour gap for disinfection of the entire office place or the workplace. In transit, the self-transport is highly recommended. If you are using a two-wheeler, wear a proper helmet, gloves, and also preferably once you are sitting, you should clean the handles and the seats before sitting and after sitting. For refueling also, you must give the exact amount and by digital payments. And if the employees should avoid a carpooling, and if no option is there, then no more than 2 people should travel into it. The boarding and deboarding of the bus is to be done only by one and one, and preferably you should sit on 2 alternate seats, and the bus should also run into a 50% capacities. The workplace, also the SOPs should be prepared. Also how the canteen should be used, how other common facilities should be used. Automatic sanitizers, dispensers should be given and should be made available into all the touch-prone areas. There will be no handshakes and no share to food, snacks, as well as washing of the hands frequently should be done. You have to sanitize your laptops and the mobile desk almost twice a day, which is the minimum requirement. And decontamination has to be done continuously, and every entrance passes should be done through the help of tunnels and possibly with the help of sodium hypochlorite. Mind you, no children should pass through these tunnels, and your eyes also should be closed once you're passing through these tunnels, because this can cause irritation when you're passing through these tunnels. As far as the other construction industry, the construction industry sector, I'm not going to the details, that it employs about 49 million people, and the lockdown over a period of time is going to opening up, because the construction workers also come from class 3, class 4, and large number of people who are working in the construction workers or building are migrants who are working. Definitely these migrants are also coming in from different parts of the country, and they can also be infected, or they can be potential carriers of infection once they come from that part of the city from where they have just now migrated, and which can again get down a secondary surge or a second avalanche of the surge of cases what we are currently having. And therefore you have to follow the 3 S's, as the screening, the sanitization of the laborer camps, as well as the construction site. Basic hygiene is very, very important for the companies as well as the sanitizing site. And you have to make soap, water, masks which are available, and frequent hand washing is important. You have to carry out disinfection of the construction site as per the WHO guidelines which are there. For larger products, you have to also depute ambulance onto the construction sites which are important. Then the developer also needs to focus more on screening them regularly. Less and more skilled labor workers need to be there. Also, contractors should also ensure the sanitization safety, and there has to be a very important thing is the zero tolerance policy is there, because this is for the welfare of all and for the welfare of all the laborers as well as everybody in the country. The retail and the e-commerce, which will also gradually open up, this will cause opening up of the malls and the different electronic shopping centers, where also mass sanitizers, screening of everybody has to be done. There has to be a no-touch policy technique, and digital payments have to be definitely promoted. You also need to see that valet parkings should be avoided, because you don't know who will be parking your car. That is also very important, and you have to ensure that the consumers also have a 6 feet of distance between them. And more important is the safety of yourself, and at the same time you should also maintain the safety of other colleagues which are there. Only you should visit malls, and visit malls only if required. So you should prepare a list and try to get all the groceries for once a week or once in 15 days, so that you minimize the visits, and the planning is very important. Only those persons who is buying the grocery should go and buy it, or even if you're ordering it for home, you have to indicate that the person is being properly screened, and they should be leaving it into the lobby of your apartment or society, and then you can get it upstairs. You also need to install the VR in partnership. initiate home delivery as per the strict protocol guidelines. Even the delivery persons need to be screened. And now, as per the new guidelines which the ministry will come up, possibly these delivery persons also we should have a certificate of COVID free. They should also be a support staff, and there has to be leaving it into the lobby of your society or apartments, and then you are supposed to get up. And the waiting time of the appointment needs to be given, and you need to give designated time so that adequate amount of time between two appointments is also given, so that the people don't clutter and people don't cluster. The aviation industry, the airport authority, you must be knowing, has recently held a meeting. Gradually, the flights will start off, and definitely it's not going to be a very easy thing, because this is the one which just connects the country, the length and breadth, within a few hours of time. And therefore, the physical distancing of the passengers will also have to be ensured at every point of the terminal. The rearrangement of the seats also needs to be done into the security hold as far as the boarding time of the aircraft. Alternate seats are also going to be occupied, but because this is also going to cause a burden on the flights, and the cost of these flights may go up, increase. There is also going to be alternate counters which will be there for check-ins, and only alternate conveyor belts will be there for physical distancing. And the domestic international terminal will have only about 50 check-in counters, and similarly things, precautions also need to be taken at the arrival, because the number of flights will also be lower because of this, also because only the major metros may be started. And similarly, the airline staff or the CISF staff also will be instructed on how to ensure and deal with the passengers for physical distancing, also maintain the screening as well as the security of the passengers, as also of the employees who are working at the airport at the check-in counters. During boarding also, the tensor barriers and the physical partial flooring also needs to be done to use at the gates of distancing. The boarding space is also going to be controlled and divided by passengers into different groups. We know that usually it is done in the form of seating arrangement, but here, since the seating arrangement may vary and the flights may operate at a 50% capacity, definitely certain boarding adjustments may change. You should also reduce the risk of waiting times at the gateway, and you should avoid transferring the passengers by bus from the apron to the positions. Preferably, it's better to have aero bridge boarding so that you can pace the boarding. After boarding also, there will be no pillows which will be provided, no blankets should be provided. There is no need for any refreshing towers, and there will be a discontinuation of beverages services only, or distribution of water bottles, or no more a la carte dining can be given into the business classes. Only tray services can be given, and the standardized sanitization process have to be continued. The crew should continuously wear the face mask, and adjacent seats and the premium economy should be converted into a premium economy or alternate seats. That means reduce the flight occupancy by about 50%. If you're using a warehouse and logistics, they are the hubs to run the staggered shifts on to a basis of manpower, and all staff again must be provided with the mask as well as the security, the screening of each and every person who is entering into the warehouse and the logistic department must be taken. Social distancing have to be followed. The Arogya Setu app must be downloaded so that it can help you to track all the persons who are nearby in the nearby distances. The management is responsible to maintain the safe distance, such as the logbook forms, and all visitors should also have a health disclosure forms, the name, address, your hand sanitizers, hand wash has to be made available. Social distancing is very important, and e-commerce shall determine the high-risk areas, impacted pandemic zones, and carry out a fumigation of all these areas by external vendors at least once in every 15 days. Wet mopping, preferably with sodium hypochlorite, have to be done, and wiping of all the trolleys also needs to be done every 4 hours, and disinfecting of all the doors and knobs every 2 hours. Vehicles which also need to be used for delivery also need to be cleaned and washed before and after each delivery. The bags which are used for delivery and carrying the shipment shall be cleaned before they leave, and also for delivery with the help of chlorhexidine or alcohol, 70% alcohol wash which can be used. All delivery staff shall be instructed to wear masks and the delivery time, and maintain a minimum of 3 feet distance with the customers, and cash on delivery option should be discouraged as far as possible in order irrespective of the item or the value of the order. The healthcare hospitals are working even now. Even the OPDs which are there, the work for the consultants and for the clinicians and the family physicians will also have to be clustered. The appointments need to be given, more of an appointment system. There'll also be social distancing there between two patients who are sitting. You need to pre-screen the reason for visiting and schedule an appointments. And the doctors also need to be into PPE. They should protect themselves. There will also be a trained nurse which are there. The entry and exit preferably should be separate. Only 50% of occupancy should be maintained into the wards, and no visitors policies. Only the one person, one patient, one visitor should be there. OPDs also need to be sanitized, mopped, clean, and all the floor surfaces, everything needs to be clean. All the educating of the staff as well as all these policies need to be maintained, and they should be all be well aware. No organ transplantation for the next few months is the healthcare policy, but this is one debatable issues. We have got the NOTO and the ROTO who are already working on it, and they will come out with proper guidelines, and the safety of the doctors as well as healthcare workers is most important and the topmost priority. The vaccines is still underway. It will take another 1 year to 2 years. Cleanliness is important. The role of telemedicine now has been approved by the Indian Medical Council and also by the Maharashtra Medical Council. And these can be paid consultations. Testing, tracking can be done. Data sharing is also important so that you know exactly which hospitals have got more frequent beds, insurance policies so that the patients don't need to rush about it, and all doctors support for automated diagnosis and predicting the diagnosis. Even movie theaters also would be shut for some more time. The screening time also needs to be changed. Even the gaming zones should be continued and they will be still kept off. The malls also will operate, but as I told you, we should not concerts would not happen, and online concerts be on rise. And once the restaurants and the pubs start, yes, online delivery will be on one of the options, but people must prefer into sitting into hygienic priorities, preferably again here on to alternate tables at a distancing. Maintaining a distancing, serving utensils which also need to be clean, and they have to be also served at a 90-degree temperature. Fruits, vegetables also need to be clean as per the protocol, and the pubs may not strive at a high immediately. The hospitality, the hotels are important. They're getting demands. The important things, the linen also needs to be changed. The restaurants also need to maintain social distancing and cleaning practices, staff hygiene. And I also recommended now the healthcare that you should have a COVID-free certificate which is there, and daily monitoring of all the temperatures, morning and evening of the persons will be there into the respondent. So this is basically in order to flatten the curve, reduce the cases, and you should postpone traveling and do not travel unnecessary for time pass, and only travel only for needed for work. Do not eat outside for at least 6 months to 1 year. As per one of the guidelines from government. Avoid unnecessary go and travel for another 6 months only if you really required. Do not travel for time pass, travel only for necessary trips or for meetings. Avoid traveling to crowded places. Maintain social distancing. Stay away from persons who has got cough. Those who have got even cough, cold, we still attend offices, but now please inform the office, and the HR should also support them by giving them a leave for a couple of days and get a medical certificate from the doctor. They should wear a mask continuously. Do not litter around. Do not let the mess around you. If you're traveling to countries where raw meat is served, preferably use vegetarian food. Avoid going to the cinemas, crowded malls for another 6 months. Maintain social distancing. If possible, park and party should also be avoided. Avoid traveling by pool cars. Improve the immunity, daily exercise, yoga, and most important also is also careful when the beauty parlors and the parlor shops open, because remember that the threat of corona is not going to end soon and it's going to take a long time. So the self-care, proper social distancing, proper hand wash, and a proper points to remember, and proper taking proper healthcare precautions is going to help us and going to be the key. Thank you very much.
Thanks, Dr. Subhal. So before we go forward, would just like to thank Dr. Subhal and Dr. Kapil and all the medical fraternity for taking good care of us and being with us for all time. We can start with the question and answers slowly. So I have two questions actually. So how far are we from a vaccine? There was news from Serum Institute that they will be starting trials soon, and probably September end we'll be having a vaccine.
See, certain studies have started. In India, currently the vaccine has only been studied into mice or into animal
Okay.
studies. They have not yet been studied into humans at all just now. Even in the United States, they have just done the first patient on human studies, which was done day before yesterday, that way.
Okay.
So it's going to take at least a year for the vaccine to come out.
The second question is, what about the herd immunity? How likely is it to get herd immunity?
To develop a herd immunity, ideally what we developed it at the time of swine flu, you must have at least a minimum of 50% of the country to be affected.
50%.
So if you want to develop a herd immunity, almost a large number of people need to be affected. But yes, once you develop it, then those symptoms will be much less. You'll just have mild fever, mild cough, but it will settle down in the next 2 or 3 days time. But the problem here is people are not reporting to the hospitals early, and as a result of which people are worsening, and therefore people in corona are progressing into intensive care units. So early reporting and seeking early medical help is important.
Okay. There's one question from Mr. Mahesh. He's asking whether the tunnels are effective and which disinfectant to be used in those tunnels. And are they dangerous to humans?
See, currently, as of now, the recommended form is a sodium hypochlorite. Sodium hypochlorite 1% or 2% in a dilution of 1000 to 1500 times is being diluted. The tunnels have currently been started, but currently, if you see recently, these tunnels have been stopped now because they have caused major skin irritation. They have also caused burning up of the eyes, and they are not allowed to be used for children. So currently, these tunnels were started, but these are not, remember, these are not going to sanitize or disinfect any persons within a short period of time.
Subhal,
So,
I will add.
yes.
See, basically, these tunnels are giving the false sense of security.
Yeah.
Please, the people are just assuming if you pass through that tunnel, they are safe. No. First thing, by spraying or you can just throwing some fluid on your body does not disinfect anything. So first thing, it is a false sense of security is a huge problem with this tunnel. And second thing, the solution which we are used in these tunnels, we have to see the concentration of sodium hypochlorite. If it is higher, it is irritated to your eyes, it is irritated to your skin, you may develop some skin diseases. So all over the now, India governments have withdrawn the suggestion of the tunnel. So it is fancy idea. It's giving some visual impact, but it is not useful.
Yeah.
Okay, thanks.
Yeah, I have a question.
Yes.
Yeah, who's that? Okay, so there's one question which asks whether COVID gets aerosolized and transmitted through air conditioning system.
I will take this question.
Yes.
See, basically, COVID is a droplet infection, but in presence of the aerosol disease. What do you mean by that? If somebody has the severe disease and he's continuously coughing, while coughing, he's not using the mask, or those who are hospitalized patient where we do the tube intubation, that means we are passing the tube into the respiratory tract. At that time, it is a highly aerosol generation, and there's then microparticles. I showed in my figure. The microparticles will remain in air for few hours, and if they get circulated through your air condition, then it will be the risky to the nearby people. So we advise no AC as far as possible. Generally, this microorganism stays in air more time in a humid environment. So if there is a heat or less humidity, they will not stay more time in this thing. So that is what the airborne nature of the disease. Otherwise, routinely, this is not an airborne. This is a droplet. Okay.
Okay.
Yeah.
Okay.
I have a question.
Participants are requested to post their questions through chat and not through unmuting them. So please request not to unmute yourself and ask the question. Thank you.
Thanks, Amol. So there's one question which is asking about the efficacy of the plasma therapy. So
yeah,
any inputs on that?
Subhal, you will answer or I will answer?
Plasma therapy, see, basically it means that they collect the plasma of a COVID positive patients, because these patients, one is been exposed, he develops the antibodies. So that plasma is then extracted from that, and then that plasma is infused into the patient so that the antigens which are there, automatic readily available antibodies are there, and these readily available antibodies, they help to suppress the severity of the symptoms. Mind you, this is not the 100% cure. It has now been tried only in about 15 patients. Currently, the trial is underway in Delhi, Mumbai, Kerala, and now in BJ Medical College soon. The Maharashtra government has approved it. It is not a 100% cure. It is just known to use it in moderate to severe patients, and it is known to reduce the severity of the symptoms. That's there.
Subhal,
Yes.
just now, I think a few minutes back, the government announced, ICMR, that this trial can be done at any center. So first thing, now it is not limited to the Delhi or Mumbai. Anybody can go ahead if they log in to this trial. Second thing, they very specifically said you have to log in for the trial. It is not the freely available treatment. So people should not be under wrong impression that if they go into any hospital, for example, unfortunately, if they landed with situation, they can use this therapy. Second thing, this therapy is recommended for the mild form of the disease, not for the moderate to severe. If somebody is on ventilator or if somebody is in a shock, this treatment is not recommended in India at least. So this is nothing but you are extracting the plasma of the recovered patient, assuming that this donor blood will have the antibodies, and that antibodies will help that patient to build up his immunity against the disease. This is what the basic theory about that. But again, this is only for the mild disease at present approved and through the trial only. If that particular patient is on another trial drug, then you cannot use this therapy. So one should know that this is not the freely available, this is not the only treatment, and this is not the only cure to the COVID.
Yeah.
Okay, thanks. One question which is really troubling us all is how to disinfect fruits and vegetables which we buy as they are raw. So,
see, fruits and vegetables should be disinfected by washing them clearly under running water. No soap or no detergent should be used for cleaning of fruits or vegetables. Only those roots, like for example, beetroot or a sweet potato or potatoes which are there, which are usually grown below the ground, you should use a small brush to clean it so that the mud particles on it is being cleaned off. Otherwise, you're just supposed to use only running water, which is important. You can use warm water, that should be fine, but no soap and no detergent.
okay. And is there any other disinfectant apart from sodium hypochlorite which is as effective?
There are 4 disinfectants. Like first thing is a sodium hypochlorite. It's 0.1 to 0.5%. Please remember, 0.1 to 0.5% is only available. Then second is a 70% alcohol, that is isoprenaline. Then third is a glutaradiol. This might be the effective. And the fourth thing is your povidone iodine. These are the 4 agents which are proven to be effective against the disinfection. Now, please remember, there is a difference in between the cleaning and disinfection. Cleaning means just you are washing the floor with any solution. That will not kill your virus. They will only clean the surface. And disinfection means you have to clean it with the sodium hypochlorite solution in a proper concentration. So please, the cleaning of your offices or your house is not the killing the virus. The virus may still remain there. So one should remember what is meant by cleaning and what is meant by disinfection.
Okay. So there's one more question. Probably it could be relevant due to shortage of masks. So how to wash a washable mask or usable mask?
First thing, please, these all masks, there are different types of the mask. One is a cloth mask, cotton mask, most of the public is using.
Right.
Second is a surgical mask, that is a triple layer. Third is a N95 mask. And fourth is the N99, N100. The name itself suggests. So I will go from the cotton mask. Cotton masks are just next to useless. They are only for preventing the dust entering into your nose and respiratory system. So this virus is not going to, these cotton masks are not going to prevent you from infection. Second part is the surgical mask. Yes, surgical mask also do not prevent you from entering the virus, but it is helpful in preventing the infection for about 60 to 70%. But N95 masks are the only mask which will help they are supposed to use by the healthcare workers only. All these masks are non-reusable. Please, surgical masks, and they are non-reusable. One should discard them after the 6 to 8 hours of the use. One should discard them if they are wet or moisture is catching. Only N95 mask, there are new guidelines says you may reuse, but there is a very specific method to reuse. You have to use it for the 8 hours. If it is not soiled or moisture or wet, then you have to keep it in a dry bag, not in the sunlight. And then after the 4 days or 5 days, you can use that mask very effectively. Try and understand, N95 mask protects you for the 95% of the virus entry. What is this N95 mask? The fibers inside the mask are electrically charged to prevent the water as well as the virus entry. If the masks are wet, then they lose their integrity. So you don't be under false sense of security that you may have the protection if you are using the N95 mask. So this is how one should remember.
Okay, so what you are saying basically is going around with handkerchiefs or scarves around your head is not that effective.
That is for the just I can say cosmetic purpose. You can use the surgical mask or use the N95 mask. But I will not advise you to use the N95 mask. They are very costly. There are the shortages there. We want this N95 mask for all our health workers who are fighting against this corona in hospitals and ICU. I will suggest to use the surgical mask. And generally, when you are moving around, there is no aerosol, this thing. So the chances of the viral infections are less. It will be only through your contamination. So even if you use the surgical mask, or sometimes cotton mask will prevent from contaminating your nose and mouth and this thing. That might be the purpose of this particular mask.
Okay, can you throw some light on whether this virus is affected by any temperature? Like there are a lot of news that some high temperature will kill it off. And
there is no evidence at present, but recently, very recently, might be yesterday, there was some claim by the USA scientists. They have not officially put it on paper. Your heat or summer season, this virus likely to be less effective or it may die. But again, there is no evidence. They have just declared it unofficially. The results are still awaited. So we just hope that it will work so that it will affect for the most of the Indians, because we are in the summer season, and that will help to get out of this viral spread. But there is no, but on the other side, humidity is pakka. Humidity is one of the culprit for remaining this virus live for almost 3 days.
It is conducive.
That's why the AC is not recommended, or recirculation of the air is not very good idea.
Okay. Okay, both doctors, I know you are stressed for time. Dr. Subhal is getting so many calls, but I'll make you answer some few more questions if you don't mind.
Yeah, no issues.
Yeah. So there's one question which asks why 1 hour break is mandatory. For instance, if it's a small organization, then probably 15 minutes, 20 minutes break will do for sanitization purpose.
That is basically to have a changeover so that a proper sterilization, proper sanitization is done, proper cleaning of the floor and all the surfaces. That's the reason why 1 hour is recommended. And in case, ideally, if you are going to continue with air conditioning, that is the time where we normally recommend that all windows should be kept open, the air conditioner should be off, and the fan should be open, so that though the air exchange occurs properly into the air conditioning, there also it has been recommended. That's the reason 1 hour is been recommended.
Subhal, I will just try to summarize for the employees, which are this thing. Just when you are going back after the lockdown, first thing, follow the safe distance. Safe distance, that means the physical distance, not the social distance. That means please keep the distance of 1 meter amongst you. Second thing, frequently hand hygiene. You just put the hand rubs or the lot of basins so that every person should do the frequent hand washing and hand hygiene. Third thing, open door policy. Keep your doors open in offices, or keep the push facility to the door. Ask your employees not to touch to the knobs frequently. Just open it with the non-dominant hand. That will suffice. Why non-dominant hand? Because it will not, we are not touching our nose and mouth with the non-dominant hand. Then minimum gathering, avoid the lunch. So I will say, rather than having anything, just divide your lunch timing. Might be there should be gap of the 50 minutes or half an hour. So more than 50 employees should not be doing the lunch, keeping the distance of the 1 meter. Avoid the tea and coffee together. Avoid the minimum gatherings together. So Zoom meetings. do your Zoom meetings with all your employees rather than calling you in an auditorium and briefing them, and mask for everyone. I think these 5 methods,
Basic things.
this thing will help you a lot for preventing this thing. Like I was going to suggest to our corporation, keep the 1 hour timing. Like one major office will have a 8 to 4, another will have a 9 to 5, third one is having 10 to 6. Like that, when you are releasing the employees, they should be released in a periodical manner rather than at a one time 1,000 are leaving the campus. Then it is very difficult to maintain the social and physical gathering.
Similarly, there should not be contact between A batch and B batch. So once the A batch leaves, then after 1 hour, the B batch will come.
Okay. So if a person gets infected, will he acquire immunity once he gets cured?
See, that is again a very difficult thing. It is basically he will develop antibodies, and it is not going to be a permanent immunity what he is going to get, because this virus exactly we don't know how the mutations are occurring and how the antibodies are going to develop. So as of now, we don't know whether it's going to be a lifelong immunity what he is going to get.
Okay. And is it spread by water, through water?
Not through water. It's basically a droplet spread and airborne spread, not through the water what you are going to drink. But there is a very, as it is shared in the fecal matter up to 37 days, there is a very less chance that a fecal-oral route of contamination can occur, because the virus is known to spread through the GIT into the feces for up to 37 days. So only if there is a contamination of the water and the drainage system, then that is one of the possibilities, but it's a rare possibility. I would keep it.
Okay.
So one should not get frightened because of the fecal-oral. Hand washing is the only alternative.
Hand washing is the only thing. So, this is scientific thing, data what I told you, for 37 days.
Right. Yeah. So there is a concern that whether cured patients are transported through the same ambulances which carry the infected patients. I don't know. Neeraj Gaikwad has asked this.
So you are talking about the transport of the COVID patients, right?
Yes.
Yeah. So he's concerned about that probably.
See, this will be the very common affair henceforth, but we have to take the precautions. Like we have to disinfect the ambulance later on. Those who are sitting in the ambulance should wear the protective measures. We have a mask over that patient, have a mask over those employees, and take the proper precaution. That is the way you can do this. We did during the H1N1. We are doing it for the all infective patients. So it is another virus. So there should not be the major change in the guidelines for ambulance transport.
Okay, thanks. Both doctors, is it possible for you to share your presentations for the benefit
surely.
of the
No problem. Surely, no problem.
Okay. So I have all the contact details of those who are attending as well as those who are registered. So once I get copies of those presentations, I'll share them with you.
Yeah.
Or I'll give you a link to download them.
Yeah, no but I will say that no need to panic. We have done all this presentation to make you aware about the current status. Our intention is not to create a fear amongst anyone. Yeah. We don't want anyone to be panicked. In fact, if you get aware, you will be in a better position. We will be very confident while going back to your work. Yeah. And we all doctors are there to avoid or prevent the infection first, and if possible, then treatment. And we have all facilities in Pune and around. No need to worry about any adverse effect of that. Please take care of yourself. Please take care of your old parents. Please take care of your high-risk relatives and avoid social gathering. That is what I will say from my side. Thank you.
Absolutely.
Okay.
And you are the people who are going to be more in touch with the industry as well as everybody. So it will be very nice if you can coordinate it and instruct them properly.
Right. Okay. So there are no more questions. So I guess I'll not keep you waiting for long. Thank you, Dr. Kapil, for giving a nice overview of the COVID-19 and Dr. Subhal for highlighting the life after lockdown. Probably we'll be undergoing this for a very long time even after the lockdown lifts. So, and of course the SOPs to be maintained by the management and the people and the workers. So very
hello, I'm interrupting. I had asked that how to handle documents which are coming by couriers.
Oh, sorry. Can you take one more question, Dr. Subhal?
Yeah.
Dr. Kapil?
Again,
how to handle?
See, if somebody is getting the document for this thing, it is very difficult to this thing. You have to just remove that cover, because inside document will not be contaminated. that cover might be the contaminated. Just dispose it properly and wash your hands.
Yeah.
Does that answer your question? Okay, I guess it does.
Yeah.
So thanks a lot.
Thank you.
Thank you for sparing your time and interacting with us
Yeah.
and giving us these valuable tips.
Thank you,
Thank you.
Prashant. Thank you,
Thank
Subhal,
you.
and thanks
Thank you,
everyone.
Prashant.
Thank you.
Thank you.
Thanks, Dr.
Thank you.
Subhal and Dr. Kapil.
Good night.
Thank
Thanks
you
a lot.
very much.
Yeah,
Thank you.
bye.
Bye.